It's Angela Berg from Cure for the Kids Foundation. Thanks for joining us for F2H3 Healthy Happy Hour. My friend Amy's here with me today. Today we wanted to talk about, the topic near and dear to my heart, and occasionally we bring up palliative care along with integrative therapies. We are working really hard to really set up and grow a strong palliative care team in the clinic to support kids going through their journeys, whether it be a cancer journey or a chronic lifelong journey like some of the rheumatologic kids might face. But it's really an important type of care that's so often misunderstood. So I always feel like we need to periodically bring up a segment where we talk about what it is, what it's not, and kind of overcoming some of the fears, talking about the advantages to this kind of program and care, and maybe dispelling some myths that people have about it. So palliative care is often misunderstood as hospice care. I always like to make sure people understand the nature of how hospice began. Hospice began simply as an insurance benefit. It's an insurance benefit that was developed in the Medicare world for older people when they die. They wanted them to have a special kind of care focused on end of life being with the most dignity and quality of care possible. And so it's based on a 6-month window of expected life, end of life being within that 6 months, where time has made it difficult to understand the difference between palliative care and hospice is that over time people began to use the words interchangeably. Palliative or palliation is simply making symptoms better and focusing on quality of life. That certainly does describe the interventions that are done during hospice, but couldn't we all use palliation during our life at all sorts of different times? We could all use a little extra support, that little extra layer of taking care of ourselves or being taken care of by someone else, a little extra help. So it's really important to understand that palliative care is something that we feel strongly should start at the time of diagnosis. It should be introduced as that extra layer of supportive care that's focused all about, as people in the clinic will hear me say, that I'm the quality of life police. I'm the one who comes in and says, okay, that's good, you have this diagnosis and we know that, and we know there's a treatment plan, and we know what our prognosis is or what our chance of cure is, or if we have no chance of cure but we have chance of remission. We know all of those medical sides of things, but how does it impact you personally? How does it impact your family? How does it impact your relationships, your marriage, your relationships with your children between parent-child? How does it impact life in general going forward? A lot of parents, Amy and I will talk a little deeper in a few minutes, a lot of parents, it's natural to go through mourning, even if you know that your child may very well beat this disease and live a long and prosperous life. There's still mourning of dreams that you had for your child that may not come to fruition, and you're not going to want to share those necessarily with everyone. The advantage of having a palliative team is that it's an interdisciplinary team. It's your medical provider, it's social support, it's psychological support. It is focused on that medical side of things. So myself as the nurse practitioner interfaces with your oncologist, but my specialty is dealing with all the symptoms that might be difficult to manage while you're going through that treatment, and then circling the wagons and bringing this entire team that includes social support, sometimes spiritual support, child life therapy and play therapy are incredibly important during this time, not only for the child, but for the entire family unit, because these diagnoses don't impact just the child. So knowing that that has been our specialty focus, I know there are parents who will sing from the mountaintops the importance of this type of care, but I thought having Amy join me today would share a really interesting perspective, because James' journey started when we really did not have palliative care at all in the clinic, let alone in the little bitty phases that we've been trying to grow. And we're presently really trying to show how important this kind of wraparound service is, and how much better the journey can be, and how multifaceted it is to not make moms necessarily depend on each other only for support. And Amy's perspective is interesting because she brought in so much integrative, but not all parents know even where to start or know somebody that can help guide them in the direction of doing that. So I know at the very beginning you were blessed with Anne being in your life, who brought a lot of education to the front and helped guide you in knowing what to research and what kind of things to look for. Will you kind of talk about what the beginning of that journey is like, and how you think understanding palliative as an interdisciplinary program with lots of pieces and parts that are continuously moving under it, how you think it could have made the beginning of your journey any different?
Gosh, so our journey started almost 5 years ago, which is crazy. And I had always, prior to James' diagnosis, I had always been kind of on the more natural, holistic side of things, and just, you know, mental wellness and things like that. When he got diagnosed, we were submerged into this medical scenario with doctors and hospitals and surgeries and radiation and chemo, and I just saw my child kind of withering within himself, and his personality changed. He didn't feel good. It obviously affected me as his mother, not being able to control the situation. You know, you feel completely out of control. At least that's my experience. That's how I felt, was, gosh, I'm helpless. I can't help my child. And he was going through such a hard time. Luckily for me, my friend Anne, who had actually been on a path herself of integrative wellness from having a whole bunch of surgeries years prior, she said, hey, let's kind of look at some things from different angles. Yes, you need this medical science. Yes, you need these physicians. Yes, you need all of this stuff, but what can we add to make it a little bit more pleasant? What can support? And you know, had there been a palliative care, that support right here at the clinic, I know it would have made a world of difference. Because, you know, we went out, and I'm somebody who, you know, I always say that a cancer mom researches more than the FBI. Like,
of course.
And you do. You're on Google, you're like, okay, I don't want to know these things, but I have to look them up. So you're just out there researching, and I found myself surrounding myself by people that could help just make the experience better. And that's really what I feel palliative care is. It's, you know, my son is almost 5 years from diagnosis and doing amazingly well, and I truly believe that a lot of the things that we did just made the journey a little bit easier, no matter what the outcome is. So, you know, lucky for us, hospice did not come into the picture, but I truly see palliative care and hospice care as two totally separate things. It's not that palliative care leads into hospice, which is what I think a misconception is a lot of times.
Of course.
People think that, oh, palliative means that one day they're going to go into hospice. No.
Right. I would like to expand on that point. The point is, palliative can certainly make a transition to hospice care much more tolerable and pleasant. And as a palliative provider, I would continue to be very directly day-to-day involved in the care if it required going down that path. But the issue is, there's a lot of different roads that we take with palliative care, and most of them end up with graduation and not needing that type of help anymore. Hopefully learning lifelong lessons, like James is still a meditator, taught himself how to meditate in the MRI machine, or in the in the radiation machine.
But
yes, but there are a lot of roads of palliative care, whereas hospice is a very single straight road expected to be care that is provided and focused just on end-of-life care in that last 6 months.
And you know, one of the things that I think of when I think of palliative care, now that I know what I know, is that the standard of care that James went through with his treatment with chemo radiation, that was all James based. Like, this is what's going to get James better. Palliative care is a much more well-rounded family approach, energetically, so to speak. You know, it's very connected. Like, if James is meditating, there's no way that I'm not going to get some of that energy and that calmness and that vibe, and vice versa. If I learn how to meditate, how to get massages or take a minute to breathe right, how to include you know, different aromatherapy, when you include that in your well-being as a family, it helps your child that's in treatment. And again, vice versa, when your child who's in treatment learns how to manage and control some of their symptoms, it creates a better atmosphere for everybody. So palliative to me is not just a singular focus or singular approach, it's just a connected, you know, that universe connected type of approach. And yeah, that's one of the things that I really appreciate about it.
Yeah, mindfulness and helping families learn how to bring mindfulness in is one of the important therapies that we use. I know that on Healthy Happy Hours, we've done a lot of the integrative therapies, but I always say the sky is the limit. There is no therapy that's off limits, because if one worked for everyone and gave everyone the relief and the benefit that they needed, we wouldn't need all of them. But being able to bring all of those things in, it makes an impact on the entire dynamic.
Oh, absolutely.
And is incredibly important. Mindfulness is a practice then that will stay, just like the meditation is a form of mindfulness. It has stayed, and James is still one of the best teachers of meditation to other children that he amazes me. And he has gotten such a peace with his soul that I think a lot of kids don't get when they're going through their journey. And James is one of my inspirations, along with little Miss Hannah, who I refer to a lot on my inspiration for really going to do this kind of care, is knowing that you know, from little Miss Hannah, the journey went to the hospice road, and there wasn't anything medically that we could do to turn it around. But having these two inspirational little beings in my life that tell me that there's these multiple roads is so important. And James continues to have such a peace and an older soul than he should have for his age. I think because of knowing that there is not just illness, but there's wellness, and there's wellness even in illness. And during times of illness, we can still nurture and look for the wellness. And you get blessed with living with it every day with him. I follow, of course, his journey, and then getting to see him every time he's here in the clinic, or if we see each other socially. But I think that's such an important part. I recently heard an NPR story about them starting to use more mindfulness in the schools. And there are some pilot programs in some schools, of course, obviously not in Nevada. We're not that progressive here yet, but in other places where it was schools that were actually in trouble with kids with lots of behavior issues, and they brought in mindfulness and specific interventions and have really turned around things in a school. So we'll begin to see some publications about that too. I love that. I think it's important too that the siblings, understanding that the siblings, that it's not just a patient focused, that the siblings are so often put in a position where the parent doesn't have time for them, and or the time that they wish they would have had, and not on purpose wanting to be hurtful, but this kind of care can actually bring families together in a different sort of way to help harmonize, if you will. Maybe the family begins to do a meditation practice once a week all together and grow together that way, for example.
What's interesting is all of the different elements that we brought into James' journey for palliative care, the things that came to us, the things that we searched out, it was definitely a team. It was not just one approach. It wasn't just mindfulness or just meditation or just play therapy. It was a whole team, and that's why having a palliative care program here at Cure for the Kids is crucial in my eyes, because it allows the family to see a team working together for the wellness of the patient. And you know, when we went through it, I'm a very open person. And I was blessed with an oncologist who said, whatever, you know, just don't hide it from me. I said, I'm going to do everything I possibly can for my son to have a good experience. I never said I'm going to do everything I can to save his life, because I, as his mother, cannot save his life. I can do my best, but that's about it. So I said, I want him to have the best experience in life that he can, and I will do anything to maintain his wellness, as far as mental well-being, physical well-being as best I can, as spiritual. So I told the oncologist that, and he said, just don't hide it from me. Just don't hide it from me. And I said, thank you, I won't. And they're very open. That's one of the things I really appreciate about Cure for the Kids, is that anything that I came here with, I was told, yes, let's try it. It's not going to hurt, so let's try it. The only hesitation I got was when James wanted to skateboard. But that was the only hesitation.
Noticeably
so. I said, no.
For good reason.
But outside of that, pretty much everything was like, okay, let's see, are there any contraindications to meditation? No. Are there any contraindications to mindfulness? No. So we really looked as a team, what's going to elevate this experience. So really, again, palliative care is elevating the experience to the best that you can, regardless of the outcome.
And you bring up a good point. We only have so much control over the outcome. As much as strides have been made in so many pediatric cancers, things like brain tumors in 2 decades have very little forward progress. And even things that have an 80% or 90% successful 5-year cure rate can have complications. So we're still talking about life-threatening processes that are going on. They could still turn around not to our favor. And for however much control, my biggest hope is that palliative care offers that hope that no matter how bumpy our road gets, we're all still in this together. And we'll go to whatever angle we need to go to make sure that we're smoothing those bumps as much as we can. Things as simple as we've talked about, being able to, we're working on bringing music therapy into the clinic during infusions and therapies, or if they come in for a sick visit and they have to be here all day on fluids, wouldn't it be nice to be able to have a music therapist who can come in and play the guitar and do some, I've even seen music therapists do fantastic special things like make a particular song with that patient, and it's so distracting to them from what they're doing. There's just so many advantages to these different types of therapies that are all included in palliative care. And being a cohesive team that talks to each other, works with each other, thinks outside of the box, and can come up with creative ways to help a child and family through these really bumpy times, I think is really critically important. And I'm so glad that you were able to research and were blessed with somebody like Ann to help guide you My sincerest hope is that as families who may not have that resource, as we grow a strong interdisciplinary kind of team here at the clinic, every life is touched for the better. And that we're able to also bring this care to where you are in the situation, or where you are at the time. I mean, we're certainly thinking big. You know, we always do at Cure for the Kids. We're thinking big. We would like to be able to bring a lot of these therapies into the home even, and be able to support families so it's seamless, and these are faces that these kids are seeing at home and in the clinic. And right down even to nutrition, partnering with folks in the community to help bring good nutrition education and support. So there's lots and lots of different ways that we can do this. I appreciate you so much coming and being able to be. You're always my willing guinea pig for First Fridays to talk about the parents' perspective. And I look forward to us having many more conversations and bringing information to you as we're able to grow this program and add more of these layers of support to help these kids who are some of our most vulnerable, but some of our biggest heroes, help through this journey. As they all teach us, we want to be there to support them as best we can through all of this journey, no matter what that road looks like. So thanks so much for joining us today, and we know your time is important. Every minute you spend with us we appreciate, and stay healthy until next time. We'll see you soon. Bye.